Heart failure is a chronic and progressive condition in which the heart cannot pump enough blood to meet the body's metabolic demands. It affects more than 6 million adults in the United States and is one of the leading causes of hospitalizations among older adults. Patients with heart failure commonly experience symptoms such as fatigue, shortness of breath, decreased activity tolerance, and fluid retention. Because the condition is chronic, effective management requires ongoing monitoring, lifestyle modifications, and medication adherence, and active participation from the patient. One widely used tool for evaluating heart failure severity is the New York Heart Association Functional Classification System. The NYHA, as it will be called from here on out, system categorizes patients into four classes based on the degree of symptoms experienced during physical activity. Class 1 indicates that a patient has no limitations during normal physical activity. Class 2 includes patients who experience mild symptoms such as fatigue or shortness of breath with ordinary activity. Class 3 describes patients who have significant limitations in activity and experience symptoms even with minimal exertion. Finally, Class 4 patients experience symptoms even at rest and are unable to perform physical activity without discomfort. The NYHA classification system is important because it helps clinicians evaluate disease progression and guide treatment decisions. Higher NYHA classifications are associated with increased mortality risk, hospitalization, and decreased quality of life for patients with heart failure. In clinical practice, the classification system also supports communication among healthcare providers and assists with determining appropriate therapies. However, the system does have limitations. Because the classification relies heavily on patient reported symptoms and provider interpretation, variability may occur between clinicians. For this reason, the NYHA classification should be used in combination with objective clinical findings such as vital signs, laboratory results, weight trends, and diagnostic imaging. Nurses play an essential role in monitoring these clinical indicators and in identifying early signs of heart failure exacerbation. Early recognition of worsening symptoms such as sudden weight gain, increasing edema, or worsening shortness of breath allows healthcare providers to intervene before hospitalization becomes necessary. Dorothea Orum's self-care deficit nursing theory provides an important framework for understanding how nurses support patients living with chronic illnesses such as heart failure. Oram proposed that individuals have the ability to care for themselves, but nursing intervention becomes necessary when the person cannot meet their own self-care needs. The goal of nursing, according to Oram, is to help individuals maintain independence while promoting health and well-being. Heart failure management relies heavily on patient self care behaviors. Patients must monitor their daily weight, take medications as prescribed, limit sodium intake, monitor symptoms, limit water restriction, and communicate with healthcare providers when symptoms worsen. When patients are unable to perform these tasks effectively, a self care deficit occurs. For example, rapid weight gain is often an early sign of fluid retention and worsening heart failure. If a patient does not recognize the significance of this change or does not understand when to contact their healthcare provider, their condition may worsen and lead to hospitalization. Nurses help to prevent this by educating patients and reinforcing the importance of monitoring symptoms and adhering to treatment recommendations. Orem described three nursing systems: wholly, wholly, wholly compensatory, partly compensatory, and supportive education systems. In heart failure management, the supportive education system is particularly important. In this system, nurses focus on teaching patients on how to care for themselves effectively so they can manage their condition independently. For example, nurses educate patients on monitoring daily weight, recognizing worsening symptoms such as swelling, shortness of breath, and understanding the importance of medication adherence and dietary restrictions. Research shows that improving patient self management skills can effectively reduce hospital admissions and improve outcomes with patients with heart failure. Integrating Orm's theory with NYHA functional classification system allows nurses to tailor care based on a patient's functional need. A patient classified as NYHA Class 2 may still be able to perform most self care tasks independently, but may benefit from additional education and monitoring. In contrast, a patient with an NYHA classification heart failure of 4 may require greater assistance with daily activities and more intense nursing support. By combining clinical assessment tools with nursing theory, nurses can provide more comprehensive care. The NYHA classification system helps healthcare providers evaluate disease severity, while Orm's self-care theory of deficit theory guides nurses in promoting patient independence and self-management. In conclusion, heart failure is a complex chronic condition that requires both accurate clinical assessment and active patient participation care. The NYHA functional classification system provides a valuable framework for evaluating symptom severity and guiding treatment decisions. Dorothea Orm's self care deficit nursing theory emphasizes the importance of empowering patients to participate in their own care. By integrating these approaches, nurses can improve symptom recognition, support effective self care behaviors, and ultimately improve life for individuals living with heart failure.